That operation was actually pretty much abandoned in this country because results were inferior to conventional hip replacement surgery. Another type of hip replacement surgery is a so-called surface replacement operation. That operation was very popular 30 years ago. A surface replacement, different than a conventional femoral replacement. The socket is the same, but on the femoral side, rather than this part of the normal femur being replaced, preserves that bony neck, and the ball is capped onto that bony area. The advantage of that was potentially that one could preserve that little bit of bone, and should you have to go back again, it perhaps would be a less complicated procedure. The problem was that failure occurred because the bone onto which the ball cap was placed was oftentimes not of healthy quality and died underneath that cap, and that prosthesis would loosen, or the bone was weakened and in certain instances the bone would fracture through that area. So that operation was actually pretty much abandoned in this country because results were inferior to conventional hip replacement surgery. But over the last 5 years, new materials are being used, metal on the socket piece and metal on the ball piece, different metal, with an idea that maybe that operation could then survive changing its technique and the materials.